This is the second session that describes the sympathetic nervous system. The learning objectives are to explain the effect of sympathetic nervous system on the body and to describe the clinical application of this session. The sympathetic nerves originate from the lateral horn cell of all the thoracic and the upper three lumbar segment of the spinal cord. It's called thoracolumbar system. The preganglionic sympathetic fibers leave the spinal cord with the ventral root of the corresponding spinal nerves. Then, they pass via the white rami communicants into the ganglia of the paravertebral sympathetic chain. Then, the course of the fiber can be one of the following three ways. It can pass with the postganglionic neurons in the ganglion that it enters. It can pass upward or downward in the chain and synapse in one of the other ganglia in the chain. Or it can pass for variable distance through the chain and then through one of the nerves radiating outward from the chain to synapse with the neurons in the collateral ganglia. The postganglionic fibers then travel to their destination in the various organs. Remember that the sympathetic division of the autonomic nervous system is responsible for preparing the body to face the fight, fright, and emergency condition. The sympathetic nervous system supplies to the abdominal viscera, which is the splanchnic or the visceral division. The preganglionic neurons which supply the abdominal viscera originate in the lateral horn cell of the lower 6 thoracic segment. They don't relay in the paravertebral sympathetic chain, but they leave the chain as the greater splanchnic nerve to relay in collateral ganglia, in the celiac and the superior mesenteric ganglia. The postganglionic fiber run through the blood vessels to the abdominal viscera to supply the gastrointestinal tract, the blood vessels, liver, spleen, and the adrenal medulla. The effect of sympathetic nervous system on the abdominal viscera. On the gastrointestinal tract, it leads to inhibition of the plain muscles of the stomach, small intestine, and the proximal part of the large intestine. It sends motor fibers to the sphincter, such as the pyloric sphincter. That's to say, sympathetic stimulation leads to relaxation of the wall of the GIT, contraction of the sphincters, and decreased gastric and intestinal secretions. Sympathetic stimulation produces vasoconstriction of the arterioles of the stomach, small intestine, the proximal part of the large intestine, kidney, pancreas, and the liver. Also, it has vasodilatation effect on some of the arterioles of the abdominal viscera. The adrenal gland is supplied by preganglionic sympathetic fibers. They end directly on special cells on the gland that secretes adrenaline and noradrenaline directly into the blood. Both adrenaline and noradrenaline are known as catecholamines. Sympathetic stimulation produces contraction of the splenic capsule, thus about 200 ml of the stored blood that is rich in RBCs is poured into the circulation. At the level of the liver, sympathetic stimulation leads to stimulation of glycogenolysis, thus increasing the blood glucose level. The sympathetic nervous system supplies to the pelvic viscera. The preganglionic neurons which supply the pelvic viscera originate in the 12th thoracic segment and the upper 3 lumbar segment. This distribution is only approximate and there is a great overlap. They don't relay in the paravertebral sympathetic chain, but they leave the chain as the lesser splanchnic nerve to relay in the collateral ganglia, which is the inferior mesenteric ganglion. The postganglionic fibers passes with the blood vessels to the pelvic viscera to supply the gastrointestinal tract, the urinary bladder, the male and female genital organs. The effect of sympathetic nervous system on the pelvic viscera, starting with the effect on the GIT. On the gastrointestinal tract, the sympathetic stimulation leads to inhibition of the plain muscles of the distal part of the large intestine and the wall of the rectum. accompanied by contraction of the internal anal sphincter, leading to retention of feces. Now, the effect of sympathetic nervous system on the pelvic viscera at the level of the urinary bladder. Sympathetic stimulation leads to inhibition of the plane muscle of the wall of the urinary bladder, accompanied by contraction of the internal urethral sphincter, leading to retention of urine. Now, the effect of sympathetic nervous system on the pelvic viscera at the level of the male genital organ. Sympathetic stimulation produces vasoconstriction of the blood vessel of the pelvic viscera and the external genital organ in the male, leading to shrinkage of the penis. Sympathetic stimulation also produces contraction of the vas deferens, seminal vesicles, and the prostate, leading to ejaculation of the semen. The effect of sympathetic nervous system on the pelvic viscera at the level of the female genital organs. In female, sympathetic stimulation produces variable effect on the uterus, either contraction or relaxation depending on different factors, such as the stage of the menstrual cycle, the ovarian hormone blood level, the pregnancy, and other factors, keeping in mind that sympathetic stimulation relaxes the pregnant uterus. Keep in mind that the blood vessels supplying the skeletal muscles receive both sympathetic noradrenergic nerve fibers that causes vasoconstriction as well as sympathetic cholinergic nerve fibers that causes vasodilatation. Accordingly, sympathetic stimulation may cause vasoconstriction or vasodilatation in the skeletal muscles depending on the underlying condition. In cases of hemorrhage, vasoconstriction occurs, which helps elevation of the arterial blood pressure. On the other hand, during muscular exercise, vasodilatation occurs, which increases the blood supply to the active muscle. Sympathetic stimulation also accelerates the chemical reactions in the active muscle, and this together with the vasodilatation leads to better contraction, delayed fatigue, and enhance the early recovery after exercise. This effect is sometimes called Orbley effect or Orbley phenomenon. What could be the clinical application of today's session? From what we discussed in the effect of sympathetic nervous system on the body, we know that the body responds to fear, extreme stress, and intense exercise with a massive coordinated activation of the sympathetic nervous system, including the adrenal medulla. This activation, the flight or flight response, ensures that the body can respond appropriately to the stressful situation, such as taking a difficult exam, running away from a burning house, or fighting an attacker. The response include increase in the heart rate, cardiac output, and arterial blood pressure, redistribution of the blood flow away from the skin and the splanchnic region and towards the skeletal muscle, increased ventilation with dilatation of the airways, decreased gastrointestinal motility and secretion, and increase in the blood glucose concentration. From this session, we know that adrenal medulla is a modified ganglia, in which the preganglionic fibers travel in the greater splanchnic nerve to the adrenal medulla to stimulate specialized cell known as chromaffin cell, upon which catecholamines are released. Catecholamines include epinephrine and norepinephrine. Pheochromocytoma is a clinical application of this session. Pheochromocytoma is a tumor in the chromaffin cells of the adrenal medulla. The tumor secretes excessive amount of norepinephrine and epinephrine, producing the following symptoms: increase in the sweat secretion, increase in the heart rate, increase in the arterial blood pressure, cold hands and feet, severe headache that may be secondary to the elevation in the arterial blood pressure, and other symptoms related to the sympathetic stimulation of the GIT. By this, we finish today's session. I hope you enjoyed it. Thank you.